Hello. Now I want to speak to you today about the growing number of violent incidents on a Tameside hospital ward. The ward is called the Saxon ward. It's a psychiatric ward, as I said, in Tameside. Now the increasing number of violent incidents is a great worry, because there's a lot of vulnerable patients now exposed to violence on this ward. Now Pennine Care NHS Foundation Trust run this ward. Now they've been entrusted with the care of vulnerable patients. Now on the 20th of this month, a very vulnerable patient, attempted to hang himself on the ward. Now this would be quietly hidden from the public, but it's people like me who witness these incidents that must come forward and tell the general public what's going on the Saxon ward and the neighbouring ward, the Taylor ward. Now these incidents are very frequent and very worrying. Now before the vulnerable patient on the 20th tried to hang himself, I witnessed a mass brawl involving patients and staff on the Saxon ward, and many other incidents where vulnerable patients are put at risk through violence. Now a lot of patients are violently subdued when they complain about their treatment. They're pushed and grabbed and thrown to the ground and injected to dope them out. Now I've seen all this, but Pennine Care would rather you, the public, never know anything about this. But I'd like to go back to the incident that happened on the 20th on the Saxon ward. Now a vulnerable patient who tried to hang himself was spoken to in a very nasty and disturbing fashion. Now a staff member on the ward spoke to this vulnerable patient in a very inappropriate manner. It was very wrong. You shouldn't be treating patients like that. You see, patients are sent to the Saxon ward and the Taylor ward not to be treated but to be punished. You see, patients have a right to express their concern about how they are being treated on a Tameside hospital ward, but when they do, they're ignored. You see, Pennine Care would rather that patients on these wards would just sit there in the corner and not express concern about how they're being treated on the ward. It's a very worrying development on these wards. There's not enough staff on there, obviously, but when the staff are on the ward, they spend more time in the office than they do with the patients. So the patients on these wards, on the Saxon ward and the Taylor ward, spend most of their time roaming the wards. And when they want something done and they go to the office on these wards, the door is shut in their face. I've seen it. But they don't want the public to know about this. I would conclude that it's only a matter of time, but a vulnerable patient does really harm themselves or herself or himself. But there has been incidents in the past, extreme violent incidents on these wards that have been covered up and the public don't even know about it. I'm a witness, I've seen all these incidents. Anyway, thank you very much, but you know, if you've got a loved one on these wards, you expect them to be in safe hands. But Pennine Care don't want you to know about the violent incidents that are taking place on these wards, because it messes up their squeaky clean image that they're actually looking after these patients, and they're not looking after these patients properly. I've seen it, and most of the staff and these nurses have got no time for these patients. They're treated as convicts, as inmates. They're not treated as patients who need treatment. They're treated as criminals. They're not treated as patients. They're not there to be treated. They're there to be punished, and that's my observations. And they don't like it. They don't like a member of the public saying what they've seen on these wards. Thank you very much. Dr. Shaw. Now Dr. Shaw works out of the Saxon ward. It's a psychiatric ward in Tameside. Dr. Shaw, if you've got my partner's best interests at heart, why did you not monitor the lithium intake? 6 or 7 months before you took over the treatment of my partner. Obviously, there's Dr. Tate and there's Dr. Sanderson. They never monitored the lithium intake. So the damage has been done to my partner's kidneys. Do you accept some responsibility for not monitoring my partner's medication? Thank you, Dr. Shaw. I hope I can get a reply one day, because you ignore my letters and my phone calls. It's just simply a simple question. Why didn't you monitor my partner's lithium intake? And that would have avoided the damage to the kidneys. Thank you very much. Hello. In reply to Dr. Catherine Shaw, Pennine Care NHS Foundation Trust, my partner's consultant psychiatrist for the moment. Dr. Shaw, when you used my partner's mental health review last Thursday as a platform to personally attack me, the family, the immediate family, believe that you are very unprofessional and should not have used my partner's mental health review as a platform to attack me. Now, as you're aware, this was witnessed by my partner's daughter. But there's another question I want to ask you, Dr. Shaw. Is it not the case that the cocktail of drugs that you and other psychiatrists have fed my partner, prescribed my partner, over the years have damaged her kidneys? Is it not a fact, Dr. Shaw, that lithium and Tegretol need to be monitored because of the well-known side effects of these drugs? Now, when you took over my partner's treatment, how long did it take you to realise that my partner's kidneys were being damaged because of the cocktail of drugs you were giving her? You see, for the general public, Dr. Shaw does not want to talk about this, despite the fact that potentially Dr. Shaw and other psychiatrists have shortened my partner's life. There's many thousands of people out there on lithium and Tegretol, and I would be interested to know how many lives these drugs have destroyed over the years. Now, it's a well-known fact that Dr. Shaw knows I know the truth regarding these drugs, and this is why she's very hostile towards me. Also, I've seen abuse on the psychiatric ward. I've seen it. The constant struggle just to get the basic principles of care on these wards is astounding. But these people, doctors like Dr. Shaw and other psychiatrists, are feeding patients all these drugs, and they're actually destroying the physical health of the patients, my partner being one of them. So Dr. Shaw can rant on forever about me, using her unprofessional methods, but the fact remains, ladies and gentlemen of the public, my partner's physical health has been destroyed because of a cocktail of drugs that Dr. Shaw and other psychiatrists have been giving her since 1976. And the most important thing that I would say to Dr. Shaw is that you know very well the adverse side effects of lithium and Tegretol, but you never monitored it. You only did it when the damage had already been done. Now you have to constantly check my partner's kidney function because you and other psychiatrists have destroyed her physical health. Yes or no, Dr. Shaw? Thank you very much. Hello?
Hi.
Oh yes, I rang up before about my partner Pauline.
Okay.
My credit ran out, that's why, because I was waiting for such a long time. So,
Okay.
what I want to know is, Pauline's been in bed practically for a week and I'm concerned.
Pauline's been what, sorry?
She's been laying in bed for a week on the ward.
She hasn't really been laying in bed for a week for a walk. She has been up and about. She's walking around. She's eating well. She's drinking well. She's sleeping well. She's coming out having a meal.
Well, don't you think it's strange that she's not spoke to me for a week on the phone?
I'm not sure why she's not spoken to you for a week.
Well, I've got reports back from my my stepson, and he says she's in a bad way last night. And could you can you tell me what medication you gave her last night, please? The blue tablet.
The promethazine.
Say that again.
Promethazine.
Right, and it's not had any effect.
Well, it did. It's not a long-term effect. It's only for a short-term effect. It calms her down.
Right. Well, as I said, I am concerned that she's not making any progress and she seems to be going backwards.
Right, okay. Well, I think you need to speak to Dr. Shaw or Felicity about this then.
Well, I've already spoke to them, and I'm just concerned about what's going on, the violence on the ward and things.
Right, what violence are you talking about?
Well, I'm talking about the man who tried to hang himself and patients throwing chairs about in the dining area.
Right, okay.
And I'm just worried that being exposed to violence is not doing her any good. Hello?
Can you hear me now?
Yes, I can hear you. Hello? Oh no, I don't know what happened there.
I don't know what happened then, I'm sorry, I don't know.
As I said, I'm just concerned that she seems to be deteriorating after being given, after taking her off the ward for 8 hours a day, just over a week ago, she's completely deteriorating.
Right, okay. I mean, you were saying about the violence on the ward, and I was just going to say, I mean, it is a mental health ward. There are going to be incidents on the ward.
Yeah, but that's no confidence and comfort to me, is it, when patients are throwing chairs and Pauline's in the middle of it?
I'm sorry, but you need to bear in mind it is a mental health ward, and we are going to have patients who are going to be quite violent and aggressive, and they are going to get angry, and they are going to be throwing things about.
So so you're saying that if something happens to Pauline violently, it's something that I should accept?
No. I didn't say something to happen to Pauline. I said things like this will happen on the ward because we've got patients on the ward who are quite mentally unwell.
Yes.
And incidents will happen.
So if she's hit by a chair, is that something I should accept?
No, I didn't say you should accept if she's been hit by a chair. When there is an incident, we do try and take all the patients to a safe place, like their bedrooms.
Well, I've been on the ward when there's been a lot of violence.
Okay.
And I'm concerned that the violence is having a detrimental effect on her well-being and her recovery. That's what I want you to know.
Yes, that can affect somebody's mental state if there is violence around.
Yes, well...
But we do try our best to keep the patients in a safe environment, by taking them to a quiet area. You
can understand my concerns, having my partner.
Yes.
I've been with my partner for 17 years.
Yeah, I'm aware about that, Roy.
So if a situation exists where Pauline tells me that she's in the dining room and chairs are being thrown around, can you understand my concern?
I can totally understand your concern, yes.
Right, thank you very much. But I need to get some progress going here because she's been on the ward for 3 months now and she needs to be coming home, really.
Okay.
All right, then we'll... Pardon?
Right. So she will be having a ward on Thursday, but Felicity will be on the ward tomorrow and she will come and see her.
Right, well, as I said, I'm very concerned about Pauline's deterioration and she should be home with her family, not exposed to violence on a daily basis.
Okay.
Thank you.
If you have any... All right, no problem. Bye-bye.
Bye-bye. Hello, this is just a short video, a follow-up to the previous video relating to the Saxon ward in Tameside Hospital, NHS Trust. Now, these are the tablets, as I said, they were given my partner. Now, these tablets are for very high blood pressure. They were given to my partner in 2014. Now, these tablets have never been monitored by a doctor, a GP, a psychiatrist or her prime carer at the Tameside Saxon ward. Now, because of these tablets, she's been collapsing on the ward at Tameside Hospital, as I previously explained. But what my concern is that these tablets were never monitored, and that means the Tameside Saxon ward, my partner's psychiatrist, doctor and prime carer are negligent in their care for my partner. Now, how many people would disagree with me on that? How would you like to be going along to the hospital to visit your loved one, your relative, husband or wife, to find them collapsed on the floor? Would you not cause a fuss? Well, that's exactly what I've done. You see, Tameside Hospital are the most complained about hospital in the UK. Look it up on the internet, on YouTube and Google. The most complained hospital in Tameside. Can you understand my fears and concerns that my partner is lying collapsed on the floor? These are the deadly tablets that could have killed my partner on the Saxon ward. But my prime carer, my partner's prime carer, wants to say, oh, it doesn't matter. Roy West is a nuisance. He shouldn't be complaining that his partner's lying on the floor in the Tameside Hospital, should he? I shouldn't, should I? It's a terrible thing. You know, this is what justice is about, and this is what human rights are about. People talk about human rights, but this is a human rights issue. It doesn't matter what race or colour or creed you are. If your partner is lying collapsed on the floor because they're taking deadly tablets they shouldn't be taking, that is a human rights issue. Thank you very much. This is the Saxon ward in Tameside. On this ward, on the 9th of the 7th, 2017, a vulnerable patient tried to hang himself. Pennine Care want to cover up this incident from the public, but it's been witnessed. A vulnerable patient tried to hang himself on the Saxon ward.